Capitol Report is a production of Senate Media Services.
The Senate passes marijuana legalization and the tax bill and is poised to debate paid family and medical leave. Plus, Senate Transportation Chair Scott Dibble highlights the Senate position on funding for roads, bridges, and transit. Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Loehrke. On a party line vote, the Senate has passed a bill that would legalize the recreational use of cannabis for people 21 and older, create a regulatory framework for the production and sale of products, and expunge the records of people convicted of nonviolent cannabis offenses.
This is not your, I guess now your grandpa's or your parents' marijuana. This is really powerful. This is really dangerous. And Mr. President, well, you're a doctor. There is no end of evidence about the troubles with today's marijuana. And there's no rebuttal to the medical evidence that people, in fact, come to harm.
People should know that these convictions have a long, lingering effect on people's lives, and this is what this bill is about. It's about righting those past wrongs. That is 100% why I'm a co-author of this bill and why this is the right thing to do. So we owe this to the people who have been impacted the most by this prohibition. It's our communities of color. It's Black Minnesotans. It's especially Black men. We owe this to them. We can legalize this. We can regulate it. We can expunge because we have to and because it's a racial justice issue.
I care very deeply about drug addiction. Alcohol and tobacco and cannabis and other drugs. Alcohol is clearly the most dangerous of them, but a lot of other harmful drugs are out there. We got to treat these things not as crimes, but we got to treat them as health issues. And the way you start getting a handle on it is making them to be, in this case, a legal product that's well regulated.
You know, I have been a long advocate for a long time in this body, protecting children from addictive substances, whether they be tobacco, alcohol, vapes, and now we are on the verge of legalizing adult use cannabis for recreational use. Members, this bill is not ready. It might be at another time, but there are way too many questions now about public safety, about local control, the lack thereof, and then also about our youth.
The effects of legalization of cannabis, which is adults use it, kids use it less because it's harder for them to get, it's safer, traffic doesn't change, crime doesn't change, jobs are created. That's the reality that we're about to enter into. But we are also going to fix the immense harm that the war on drugs has perpetuated, particularly against Black men.
I got pulled over a couple years for alcohol-related offense. I tested a .09. So, folks, I was one beer over. One beer too many. And I've always been very careful about it. There's a weight scale and how many drinks you can have per hour and what your weight is, and you can go through that. You can kind of see where you're at. So I was a .09, one beer over. What happens with testing with marijuana? How are they going to know what that percentage is? They don't have the test for it yet. And yet the effective date of this bill is going to go into effect before we have that?
Fundamentally, this bill puts our families at risk. The increased access to marijuana, to cannabis products, fundamentally will put our children at risk, our communities at risk, our businesses at risk.
With the prohibition of cannabis, with the war on drugs, we have not achieved any of the goals, but instead have done immeasurable harm to our people, disproportionately to people of color. It's unacceptable for the state to do that kind of harm, devastate communities, and walk away as though it's the price of doing business.
Funding for transportation got a $1 billion boost thanks to the $17.5 billion budget surplus. Both the Senate and the House have recently passed funding packages to support transportation over the next 2 years. Joining me to highlight aspects of the Senate's proposal is the chair of the Senate Transportation Committee, Senator Scott Dibble. Thank you for joining me.
Thanks, Shannon.
You've said that the legislature has not invested meaningfully in Minnesota's transportation infrastructure in 30 years. This bill includes $1 billion of the surplus in one-time spending. How far will this and the proposed tax increases that we will talk about in a moment go in meeting the state's needs?
Well, $1 billion is a lot of money. Transportation infrastructure is very expensive, and it's also subject to all of the inflationary pressure that we've been hearing about, and construction inflation is actually a little bit worse. So we're going to get a lot of good things done with these one-time dollars. However, they are just one-time dollars, so we're going to get some projects done and some priorities and help improve public safety. The transportation bill includes Department of Public Safety, trooper types of investments as well. So it's a good start, but the important thing is to make sure that we have some sustained ongoing revenue that supports the overall infrastructure, the roads, the bridges, local bridges, as well as our transit system.
And you're previewing my next question just a little bit, but I'm going to ask it anyway. Last year's report card by Minnesota civil engineers gave the state some pretty low grades when it comes to infrastructure. It was a D+ for roads, it was a C for bridges, it was a C- for transit. The finance bill contains an increase to the vehicle registration tax, an increase in license tab fees, and an increase in motor vehicle sales tax. So some critics are saying, why do we need to raise taxes when there is this enormous surplus?
Well, as you mentioned in your opening comments, citing me, we haven't really made a meaningful investment in our overall transportation infrastructure for 30 years. We did pass a bill in 2007/2008. It was kind of a process. And it put a little bit of new revenue into the system, but prior to that, it was really 20 years prior to that. So it's been a long time. We've lost a lot of ground relative to the size of our population, the deterioration of our roads. We've lost a lot of ground relative to inflation. All the revenue sources actually within transportation, remember transportation is funded outside of the general fund. So when we're talking about the surplus, we're talking about the general fund, which supports education and healthcare, are in decline. So we've got a large system that we've inherited from those who passed before us, which is wonderful and a fantastic legacy for our state. That's why we've been a successful state economically. But that roadway system, everyone can see as they drive around, whether it's trunk highways or the county roads or our local city roads, are full of potholes. We had this really rough winter, lots of freeze-thaw, lots of potholes. That's because we just haven't taken care of the system. The revenues are declining, the system is deteriorating, and we need to make the investment so that we have a really good economic infrastructure now and one to pass on to those who are going to follow us the way we got to inherit such a great system.
In terms of transit, both the House and the Senate are proposing a metro area sales tax to pay for transit-related needs. The Senate's proposal is 0.5%. The House is 0.75%. What's your argument to your House counterparts to keep it on the lower end?
Well, this is a negotiation, so, we'll have some discussion about, what is the actual need, what is the reality of transit, and what transit means, both for keeping the young professional workforce here in the metro. We talk about population loss in Minnesota and the metro area, and those are young people going to other urban centers that have transit, that have bike walk, that have really vital and vibrant communities. We also understand transit as fundamental to people who either can't or have real barriers in terms of accessing jobs and school and other opportunities, whether they're low income or senior citizens, or if there's an age issue or some sort of geographic barrier. So I'm not sure that I'm adamant that we're going to stay at 0.5. I don't know that we need to go up to 0.75. We're going to have this conversation about what is the real need and what does transit investment in terms of the prosperity and individual success, as well as success of our overall economy, is going to look like.
Bring Me the News cited data from Metro Transit earlier this year that showed crime on buses and light rail rose 54% over the previous year. WCCO in March captured video of flagrant drug use on the Blue Line and the Green Line. What does this budget do to improve safety?
Quite a bit. We are extremely concerned about that. I actually take transit, not every day, but I try to take transit once a week or once every 2 weeks. And so I see it and experience it myself. We had a lot of testimony. We had this one young man with a disability who used to take, very, very proud of his job, used to take the train every day. He was assaulted on the train, and now he just doesn't take transit anymore. His mom needs to drive him. And we've seen the news. It is an existential threat to the viability and usability of our transit system. So we have an important initiative where we're really going to kind of have the right approach to enforcing violations. Some stuff is criminalized way too heavily, so it's not even taken seriously when those charges are made. So we need to make sure we have the right type of violation that people receive so that there is a follow-through and a consequence. Putting a lot more personnel on the trains, shy of law enforcement, but can enforce for behavioral issues and other kinds of violations. Also help people who need help, even just people who need direction. Make sure the stations are clean, everything is orderly, but also there's going to have to be a law enforcement response as well. So there's resources as well as a whole initiative to really change the tone and the culture and the expectations on our transit system. It's job number one.
The Southwest Light Rail Transit project has taken significantly more time and cost significantly more money than was projected. This bill would remove the authority for projects like this from the Met Council and instead give it to the Minnesota Department of Transportation. How will this change make a difference for future projects?
So that change in particular will allow for an agency with demonstrated capacity and competency to build large projects, managing large prime contractors, the complexity and the expense that goes into managing these gigantic infrastructure projects. MnDOT is expert at that. They've actually built the Blue Line from downtown Minneapolis to the Airport Mall of America and did an excellent job. Plus they built, giant bridges and, all kinds of, and they do a great job. They bring almost all their projects in on time and under budget or at budget. And so it'll really improve that situation. Met Council has some other issues that have come to light through a lot of this analysis investigation. The whole process of responsiveness and accountability and interaction and relationship with the metropolitan area which it represents, which it delivers important, vital, frontline, daily local services that people touch and feel and use every single day. It's not an elected body. It's an appointed body. It has the right to tax. It has the right to supersede local laws. It delivers these phenomenally important and very, very expensive services. And I feel like it really needs to function better, be more accountable, be more responsive, and it needs to be an elected body, much like counties are and cities are. It's basically a large county. And so it needs to transform itself that way.
So Met Council, there's a move to make it an elected body also in this bill?
There are some pieces in there, not straight up, but a process by which it would hopefully get to that point.
Okay, one final question. $50 million is provided in the Senate plan for the Northern Lights Express, which is a passenger railway from the Twin Cities to Duluth. Why is this investment and others in intercity passenger rail important for the future?
Well, the whole means by which we provide alternatives to driving for a whole bunch of different reasons, giving people access to all kinds of opportunities throughout the state, throughout the region, not necessarily forcing them to drive is good for giving more people access to opportunities. There's going to be a lot of veterans, for example, who come down to the Twin Cities to access the VA. There's going to be a lot of students and a lot of workers who can really locate in Duluth and work in the cities and vice versa, because it's going to be a very, very fast commute between the two. And it also has an environmental benefit. And the projections, and it's not just about getting from Duluth to Twin Cities, but all the points in between as well. So the economic vibrancy that occurs and the opportunities that occur for people all along the route. Not just the route itself, but people who drive to the route. So there's a whole travel shed of people who are going to benefit from this investment.
Senator Scott Dibble, thank you.
Thanks, Shannon.
Also on a party line vote, the Senate passed its version of the omnibus tax bill, which includes refunds to qualifying taxpayers, raising the limit on tax exemption for Social Security benefits, and property tax relief.
I'm concerned members about the tax increases, especially on businesses, and it's going to make any companies that do business in Minnesota, it's going to make many of those companies have a competitive disadvantage because of this new mandatory worldwide tax.
$1 billion for rebates for middle-class families, $1 billion for Social Security tax relief for 76% of seniors, middle-class and upper-middle-class seniors on fixed incomes, $1 billion for child care expenses for families, and $1 billion for some of the poorest families out there to reduce childhood poverty.
I am concerned about the increase in taxes, and this is nothing political. I don't want to get partisan about it, but as I've said many times, I'm involved in real estate development, a lot of businesses, and they are concerned, and they are leaving the state. And a lot of these businesses are the ones that are creating jobs, providing investment, paying property taxes. There's just a lot of businesses that are concerned about the tax environment here in Minnesota, and folks, they are leaving.
Helping communities with public safety, helping on property taxes, increasing the market value exclusion, increasing the targeted property tax refund. Members, we talk so often about property taxes and the relative regressive nature of it. And you know, I'm proud of the fact that our state is, I think, rated the 5th or 6th most in terms of progressivity in its overall tax system. This bill makes it more progressive.
Representing a border district as a state senator and having served as a councilman and mayor for a border community, I have been used to offsetting the problems caused by the state of Minnesota. And truthfully, I honestly do not feel that this bill will help our communities to develop the business and jobs that they need, nor will it stop the migration of our retired people from this state.
This is my favorite day. I've told my own caucus this, my favorite day of the whole session to deal with the tax bill. It went by for me in a blink. In a blink. I urge a green vote.
And following passage of a measure to memorialize a section of Highway 5 in honor of Prince Rogers Nelson, lawmakers and supporters gathered outside the Senate chamber.
Today is such a great day, not only for the state of Minnesota, but for the city of Chanhassen, which Prince called home. This idea came several years ago by a couple of gentlemen behind me when they came and I was sitting on the Chanhassen City Council and they said, can we please honor and memorialize our friend, the legendary artist Prince, with this sign, and can it be purple?
Prince never asked nobody for anything. I think this is one of the greatest gifts we can give him. The city of Chanhassen, the state of Minnesota, and the world, he deserves every bit of this.
And we named it appropriately 717 because 7 was such an important number to Prince. But I really want to give a shout out to Minnesota Department of Transportation, which was really an essential part of this bill.
We all worked very hard together to not only get them to be purple, to get the 7-mile stretch. This was already dedicated to Augie Mueller, a former legislator. So we had to talk to that family, work that out, and you know, I'm just really happy that everybody's pleased.
Prince, who plays every instrument you can think of, right, and who was a great lyricist, but who also believed in bringing folks together. So even my choir, when I conducted Excelsior, he always had times that he would call me and want us always to come and do music. And so when he did Rave to the 2000 from 1999 to 2000, if you look on the video, you will see me on there just because he was always...
Tuesday, on a vote of 68 to 64, the House passed a measure to create a state paid family and medical leave program. The Senate will likely take up the bill in the coming days. Earlier this session, I spoke with Senator Elise Mann, a physician and sponsor of the Senate bill, and I began by asking her why it's important to pass this legislation now.
The time is now for paid family leave, right? We have 11 other states and DC who have already passed it and are starting up their programs. And we have learned so much from them. And we know that paid family leave has so many benefits for everybody in the community. It provides financial stability for our working families, obviously, right? It decreases infections in children and newborns, decreases ear infections, pneumonia, GI infections, decreases hospitalizations, decreases clinic visits at a time when our healthcare system is so overwhelmed, right? We get to keep our babies at home at a time where a child care crisis is going on in this state. And the other thing that it helps is that when we have our elderly folks, our aging parents and grandparents, they don't have a place to go, right? We have a long-term care crisis in this country as well. And now this bill allows people to stay home to take care of their family members as well. So it's going to impact every sector of society, from healthcare to childcare, and most importantly, it's good for business, right? We see that places that have paid family leave, their workers take the leave that they need, which is oftentimes less than what they're allowed to take, because it's hard to stay at home at partial wage replacement. And then they go back to work. And in places where we don't have paid family leave, people leave the workplace and do not return to work. And so in the long term, this is really going to affect our workforce shortage crisis that we currently are seeing as well. So again, this bill is going to impact all sectors of our society. It's good for our babies, it's good for our moms, it's good for our families, it is good for the economy.
Well, and I want to hone in a little bit. You outlined a bunch of medical things there, and you are new to the Senate. Welcome to the Senate, but not new to lawmaking. You served a term in the House where you were co-author of this bill when it passed in 2020. But you were also a physician. And so for just a moment, if you could put your physician's hat on and explain why, in particular, from that point of view, this is a good bill.
Yeah, so as far as medicine goes and healthcare, this is an incredible bill, honestly. Again, what we talked about just with the babies, right? Ear infections, GI, pneumonias, hospitalization, clinic visits. At one point in time, Children's Hospital had 30 children waiting in the emergency room for a hospital bed, right? That's the current state of our healthcare system. And so to decrease that burden is going to be very significant. This has also shown to increase maternal mental health, right? Depression is one of our most costly diagnoses. This helps that. It helps with breastfeeding. We know that breastfeeding helps healthy moms, healthy babies. This will impact the duration of breastfeeding. And again, we have data to prove all those things. So, and lastly, just maternal health in general, right? We're seeing in America especially, the maternal morbidity and mortality rates have doubled in the last 2 decades. The rest of the world, those numbers are going down. But our moms are not safe when they become pregnant in America. And so to have a time period where they are able to get to the doctor when they need to without fear of losing their job, it impacts maternal health significantly. And again, we've seen that happen in the rest of the world, and we've seen it happen in the states that have enacted this law. And so from a health perspective, it's quite important.
You mentioned this, a dozen states have enacted some form of paid family medical leave. Speaker Hortman mentioned that here in Minnesota, because of our enormous budget surplus, we may be able to fund much of the program up front, and therefore it could begin earlier than other states where there was several years before it could achieve the funding necessary. So assuming that happens, what do you believe is the earliest that this program could come online?
Yeah, so what other states have done is that you need time to set up the program, right? To set up the infrastructure of the program. And on top of that, you need to fund the program. And so again, other states, they will fund the program for about a year before you are eligible to receive benefits. With our surplus, we can avoid that initial year of funding without benefits. And we can start funding the program and getting benefits on the same day. We still need that time to set up the infrastructure for the program, and that can take 2 to 3 years. It's quite an undertaking. But again, we've seen it being done very successfully across the country, so we have every ingredient to do it just as well, if not better, here in Minnesota.
So essentially, the state is going to create an insurance program similar to the Unemployment Insurance Trust Fund. Employers and employees will pay into this, and then people will use that pool of money at a qualifying event to be able to take this benefit. Why a state-run plan as opposed to going with a private insurance option that, the state would maybe just require employers to buy? Why this way and not the other way?
Yeah. So only one state has essentially privatized this program, and that's Connecticut. And what Connecticut is seeing is that their costs to run the program are about twice what other states cost, because there has to be state oversight of the insurance companies. And they also have to be still in charge of all the appeals processes. And so it's actually much more expensive, we're seeing, to privatize the program. The other thing is that we have private insurance now that provides these benefits. And in Minnesota, 13% of people have access to paid family leave. So the private market that we have simply is not working. Right? The other thing with private insurance is that it is the discretion of the insurance company whether to provide or deny benefits. And we see that it is within, unfortunately, it is within those discretions that inequities lie. And so the fact that women and people of color have significantly decreased access to any of paid benefit leaves in the state, I don't want to say it's by design, but we want to make sure with this bill that we are not leaving anybody behind. And so that's why leaning on the experiences of the other states, having a state-run program is significantly more successful.
What are some examples of qualifying events, and then how is it verified? How can the state ensure that the benefit would not be abused?
Yeah, so again, in other states, we're not seeing abuse of the system because it is very difficult for people to stay at home with 60% of their pay. Right? And so, and to qualify, you have to have something significant. So a pregnancy, of course, new baby. This can be an adopted baby or a foster baby that you need time to bond with. All of those qualify for 12 weeks. And you can only use that 12-week one time in a year. The other qualifying benefit is a significant medical event. So if I have a stroke and I cannot work, I can take 12 weeks for that. But in order for me to qualify, I need medical documentation, right? So I can't just walk into my work on a Tuesday and say, I'm going to take 12 weeks today, thanks, right? You have to go through significant documentation in order to qualify. And so for all those reasons, fraud is just not something we're seeing in the 11 other states.
Just quickly before we go, is this program just for full-time workers? Is it prorated for part-time workers? Are there any workers who don't qualify, like independent contractors? Is this going to be for everyone or just most people?
So this is for everyone. You have to make a certain amount of money in a year's period to qualify, meaning that you are engaged in the workforce, right? So if you make that money, whether you're part-time or full-time, if you make that amount, then you qualify. Independent contractors can opt into the program. They can pay that insurance premium as well and take their leave when they need it. So again, we're working really hard to make sure that it's for absolutely everyone.
Senator Elise Mann, welcome to the Senate.
Thank you
so much.
Thank you.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Loehrke, and on behalf of all of us at Senate Media Services, thanks for watching.